Dr. Nadorff, by this time we all know what social distancing is and we all know why it's important, but maybe something that we're not focusing on is the impact psychologically that it may be having on us. What are your thoughts there?
I agree. And, it's challenging because in psychology, there's a lot that we know about with social distancing. Certainly, we know about loneliness. There's a ton of research on that. But these are different times. And I think in psychology, what we're realizing is that everything has changed. And while there's a lot we can extrapolate from the prior research, we also recognize that, here you have this combination of job losses or job stress, worries about health, and this need to be distant at the same time where it's being forced upon us. We haven't seen that in over 100 years. So it's really important for us as a field in psychology to kind of take a step back and figure out what does that mean? What are people actually struggling with, and how can we help them with that?
And that's actually a subject that you guys are doing a study on at the psychology department at MSU. What does that involve? How does that work?
We are. So we're doing a survey right now where we're getting a better sense of how people are dealing with this distance and what ways are they coping with it, and also by virtue of that, what are their struggles, so we can better understand as a field how can we go and help them, how can we help overcome some of the negative effects of this.
Right. Now, are you looking for participants currently? Have you already been talking with people? Where are you at in this process?
We are. So we're currently recruiting, and the website will be here, but there's a website you can go to very easily in order to participate if you'd like and help us better understand the effect that distance has had on you and the ways you've coped with it, and also just some of the stressors that it's brought into your life.
And what are some of the questions that you're going to be asking with that study?
So we're really interested in a myriad of different ways that people are interacting with others. We have several questions on pets. We're really interested in with how that relationship has changed now that people are home more and they're with their pets more. So does that make you closer to your pet, further from your pet? Are they a help or a stressor? So just things like that to help us understand what does your day-to-day life look like now, and what are your current stressors, and what differentiates those people that are doing really well with this from those that are struggling more, so we can make recommendations for those that are struggling.
As a mental health professional, has it surprised you how people have reacted to social distancing, or was this something that you would have expected?
A lot of it's as I would have expected it. It's that combination of a lot of people take it very seriously, but also struggling with the impact of being isolated. With other people that, unfortunately haven't been following guidelines as much. And so it's been the normal range that you'd expect with that. But I do think what has been interesting is just seeing over time how that has changed. So where people were at the very start of this epidemic has changed as we've gone along, and that's another thing that we're trying to look at is, as we get more information and as we progress through this, how do people change? How do, the stressors change, and how do people's willingness to actually be distant change? Because all that is huge implications for the healthcare system.
Do you think evaluating people's reactions to social distancing right now may help us as a society in the future looking forward if something like this were to happen again?
Absolutely, and also, frankly, we don't know how long this is going to go. I'm hoping it'll be short, but, it could be years potentially. So the more information we can get now is going to help us, in the case it is a longer runway than we'd really like it to be. But if nothing else, it's going to better prepare us going forward and also help us understand how we can, best, band together, even if it's distantly together, in order to help overcome these challenges.
Well, Dr. Nadorff, thanks so much for talking with us again this afternoon. We appreciate it.
Absolutely. Thank you.